Dr. Zaki with you, and the topic is orbital complication secondary to acute rhinosinusitis. So, as I have mentioned in part 1, we are going to deal this topic in 4 parts, and this is the second part, where I am going to concentrate on the presentation of the disease, the patient complaint, and the examination part. So, let us start. As I have mentioned in part 1, it is very important to know the different stages of the disease in the orbit. I have already mentioned about this in the part 1 video. So a better understanding of this video, if you want a better understanding, kindly watch part 1 and do watch this part again. So let me brief about this. Once in the orbit or the eyeball or the orbit, the disease can be it can progress in 5 stages. One is the preseptal orbital cellulitis, where the cellulitis or the infection is in front of the septum. Postseptal cellulitis, where it has crossed the septum and entered the eyeball or the orbit. Subperiosteal abscess, where the abscess formation has started and it is confined to one part of the orbit, especially below the covering of the bone. The covering of the bone is called as a periosteum. Fourth stage, the subperiosteal abscess, it has spread from into the orbit or the eyeball, occupying the whole of the orbit, orbital abscess. And the final one is spread from the eye into the cavernous system, which is called as a cavernous sinus thrombosis. Now, the patient complaint and the examination all depends upon which stage the patient is in. So, as I mentioned in part 1, most of the patients, they are pediatric age group, because the infection, sinus infection, the most common being ethmoiditis, which is more common in children, and the separation between the ethmoid sinus, air cells or sinus, and the orbit is covered just by separated only by a thin bone called lamina papricia. So, chance of spreading of a severe infection is very high. So, the patient complaint or the parent complaint will be that the child had been having nasal block, nasal discharge, headache for few days, and along with that they had fever also, and of late recently we have noticed that there is eyelid swelling of one particular side, and he has started complaining of eye pain also. So, that will be the initial presentation. So, this can be the early stage, that is preseptal or postseptal cellulitis. So, as and when, suppose the patient has presented late or not given proper treatment, he goes into the next stage where he will have all these complaints and the eyes become more prominent eyes. It gets pushed anterior or laterally, depending upon the position of the abscess inside the orbit. And when he goes to the next stage, that is orbital abscess or can be cavernous sinus thrombosis, he develops double vision, and finally even his vision drops down, he will not be able to see, and rarely they can lose their vision, they can become blind also if not properly intervened at the right time. And finally, when he loses his eye and double vision, that time itself he will not be able to open his eyeball. And most important thing is, when he goes to the last 2 stages, there is high possibility, especially the last one, cavernous sinus thrombosis, there are high possibility that infection can spread from one eye to the other eye within a day or 2. So, it is very important that we give importance to this and start the treatment at the earliest. So, these are the complaints of the patient presentation. Now, as soon as the patient comes to us, we have to do an examination. So, first I will tell you the examination, the eye examination from the ENT point of view, what are we going to do? So, I have shown examination in adult, but usually these are pediatric patients. So, what we have to do is, first we have to examine the swelling of the upper eyelid and the lower eyelid, one. Then see whether the conjunctiva and the sclera is normal or not. So, conjunctiva means the part, this part, lower part is called the conjunctiva, and the white part which you see is called the sclera, whether this is congested or not, whether it is, what I mean to say is whether it is red in color or not, that has to be seen. And at the same time, I like to examine the eye movements, and when we do the eye movements, whether it is painful or not, And it is, I would like to tell you that eye movements checking in a child is very difficult, especially so when the child is febrile, having fever, and all the staff nurses already put an IV cannula, which is also painful, and the eye movements is going to be painful, and the eyelid swelling is also there. So we have to, doctors have to open the eye, check for eyelid movements. So it is not that easy to examine a child. Whatever it is, we have to check for eyelid movements, which is very important for us. Likewise, after that, we have to see the response of the pupil to light. So this is what I am going to demonstrate in this video. So this is examination of the eye from the ENT point of view. But the most important being, we will urgently give an ophthalmology consultation. So the ophthalmologist, they will do an complete examination. They want the vision to be checked, whether it's far vision or near vision. And at the same time, we would like to have check for color vision also. Because before the vision loss, what happens is the color vision goes first. So if you are very cautious and if you can pick up at this stage, it's very good. So color vision has to be checked with Ishihara's chart, and at the same time they'll have a look with the slit lamp also, and the most important being fundoscopy. This is very important, especially in the last two stages, orbital abscess and cavernous sinus thrombosis. So that completes the ophthalmology consultation, and they will give us a few points to be followed, treatment points to be followed, which I shall tell you subsequently. Now, general examination of the eye is over from the ENT point of view as well as the ophthalmology point of view, and next we will proceed with nasal endoscopy. So nasal endoscopy, most of the time we see pus discharge inside the nose. So we'll use an aspirator and we'll aspirate this pus and send it for gram stain and pulp culture and sensitivity. And we'll like to keep a small pack in that particular area, and about that I'll tell you when we deal with, when I'm going to detail about the treatment. Now examination specific to the eye. This depends upon the stage. So let me tell you stage by stage so that you can understand better. To start with the normal. Normally the eyelids will be normal, the sclera will be velvety or red in color, and the sclera, the conjunctiva, sclera will be white, more so in females, in children also, and eye movements will be normal. That is about a normal condition. Now, when the patient is in preseptal orbital cellulitis, that means the infection is in front of the septa, as you see here, is in front of the septa. In that stage, what happens? It starts with eyelid swelling, and at the same time they'll have conjunctiva and scleral redness also. But the eye movements is going to be normal. So when we do a CT scan with contrast, it will show there's a diffuse swelling in front of the septum, and it will show that since it is done with a contrast, it will say it is not an abscess, it's only a cellulitis. Next, suppose he goes into a next stage, that is post-septal orbital cellulitis. What happens is from here, from the septum, it has crossed the septum, it has gone into the orbit, and there is cellulitis inside. Still, even now, there is no abscess formation. At this stage, what happens is the lid swelling becomes more, the conjunctiva and the sclera becomes more red in color, and eyeball movements are still okay but slightly painful. And when we do a CT scan, we see there is no abscess but there is a cellulitis in the orbit. So coming to the third stage, these first two stages, that is preseptal orbital cellulitis and postseptal orbital cellulitis, both these stages can be managed medically without surgery. That doesn't mean that we can give you 100% guarantee that surgery is not needed. What happens? Sometimes what happens is, even after starting treatment, this post-septal orbital cellulitis can progress to abscess formation, or it can progress inside the orbit too. That's why admission is mandatory. Now coming to the third stage, which is subperiosteal abscess. Here what happens is, already there is cellulitis and that forms a abscess just near to the bone. So examination findings will be, the eyelid swelling is going to be more and will be congested, and the patient is not able to open his or her eyelid easily. And now at this stage they start experiencing pain inside the eye, especially so during eye movements, and the eye movement is going to be restricted. So when you do a CT scan, this is going to be the finding. With contrast, it will show that there is an abscess inside. Now if he proceeds to the next stage, orbital abscess, what happens is, the lid swelling is still going to become more, the pain is going to be severe, and the eye movements is going to be completely restricted, and it's going to be very painful. So when you do a CT scan with contrast, you can definitely find an abscess sitting in the orbit. Now the final stage, that is cavernous sinus thrombosis. Here the eyelid swelling is almost the same, pain is little more, but it has spread. Pain is not only in the eye, but it has been in the forehead and is spread to the head also. And at this stage, what happens, if you are not careful and the patient is not intervened at the right time, the infection can spread from one eye, it can spread to the opposite eye also. And eyeball restriction, movement restriction is going to be marked, as seen in this disease. Now at this stage, we need CT scan with contrast, and especially we need magnetic resonance venography too. Now I'll show you some real photographs. Here we have a patient who has been diagnosed as preseptal cellulitis, and this boy has postseptal cellulitis, and this baby has subperiosteal abscess, and this gentleman was diagnosed as orbital abscess. So this is how the orbital complications of acute rhinosinus, this is how the patient presents to us. So now do watch the next video, the part 3 video, where I am going to concentrate only on the investigation. Thank you so much.